Does your shoulder really hurt sometimes? Do you reach up high for things and you feel a little twinge of pain? Or maybe you get home from work and it just feels like it's aching and throbbing. Or maybe you wake up in the morning and it feels very stiff and achy and you have to kind of warm it up. Have you got that type of pain and you've also got quite an active job? Maybe you're a cleaner, maybe you're working in construction or something that involves a lot of shoulder movement, and your shoulder is just getting really, really sore and it seems to be getting gradually worse. Then this video is for you, because I'm going to help you understand exactly what it is and what it is not. And this is going to be the first part in a 3-part series where we go through that, then we'll talk about the literature and what the recommendations are. And then in the final video, I'm going to create an exercise and rehabilitation program you guys can follow at home to help recover from this type of injury. Hi, my name is Paul, and in this channel, we cover all things pain, injury, recovery, education, and living a healthy lifestyle. And we usually do that from the comfort of my beautiful summer kitchen on the island of Sicily. I recently moved here, and then that is why I wanted to start this YouTube channel, because I'm no longer in the United Kingdom, in Scotland, where I'm from and where I trained and where I practiced as a physiotherapist. I'm now here, so this is my way of still being able to help people. So let us begin. So this type of injury is known as something that is called non-specific shoulder-related pain, which is a terrible, terrible name for it, because it really is just sounds so lazy. It's like, we don't know what's causing the pain. It's non-specific, but it's the shoulder, so there's the pain. But it's actually the best terminology we can use. Other things that are appropriate are rotator cuff related pain, and we'll explain that. And then also subacromial shoulder pain is another appropriate term. I'm now going to spend the next few minutes touching on what you should not be calling it. And if you've ever been told that this is what your shoulder is, then I'm here to tell you that you need to stop thinking about it like that and remove it from your pain. So this type of injury was commonly called shoulder impingement pain or syndrome. Basically, back in the 70s, some orthopedic surgeons were wondering why there was a lot of these shoulder pain coming up patients all across the kind of Western and working world. Why were all these people getting this shoulder pain? What could the reason be? And they theorized that the pain was coming from the subacromial space. So basically, in your shoulder, you have the humeral head and you have the acromion sitting above it, which is just a bit of bone like so. And on the humeral head and attaching into there is lots of muscle tendons, mainly the supraspinatus and the long head of your bicep tendon, but then also the bursa, the subacromial bursa, which is a fluid sac that helps keep the joint mobile and fluid, and, you know, like WD-40 almost, if you want to think of it like that. So there's those structures there. And they noticed that some people kind of naturally have a bigger gap or a smaller gap. So they theorized that the size of the gap was the cause of the pain. So by going in and doing what they call the decompression surgery and basically increasing that space between the two, you would alleviate the symptoms. So this has been common practice for the last like 20, 30 years. But we have now learned that there is no correlation between the size of that space in between your humeral head and your acromion and the shoulder pain. Some people have them sitting right on top of each other and they'll never experience this type of shoulder pain. Others have had the surgery and it has made zero difference. And I mean zero difference. Their pain has not improved, their function has not improved. Others have seen some benefit, and whereas others, it's probably even got worse. And obviously surgery is invasive and it's also highly costly for both the healthcare organization or the national organization and for the patient as well. So nobody really wants to go to surgery, and we now know that it is not recommended. Why? Because, yeah, like I said, we all have a varying degree of space. There is no perfect space between these two structures. And also there's just so many other factors that go into this type of injury. But that's the main thing, is that we see no correlation between the space and the pain. So therefore, the reason for doing the surgery is to increase that space to relieve the pressure. Because essentially what happens, particularly in this region, is your muscle tendons, mainly the bicep and the supraspinatus, they thicken and they shrink. But this is normal. When you put them under stress and tension, when you're maybe exercising or when you're maybe working, the tendons naturally do get thicker. But the idea is that during this process, they're pressing on the bone, and that's what's causing the pain. But we know that this is just a normal part of the body function. So it's typically not going to be causing permanent pain in the shoulder. You may feel some discomfort every now and then from it, but it's nothing to worry about. So it's the normal mechanics and movements and things of the shoulder. So then that's why we don't want to say shoulder impingement, because it indicates that. The other thing with shoulder impingement syndrome that we've learned is that if you think about it, it sounds like there is something wrong, something's in the way, impinged. You know, it implies that something is stopping something from happening. And when we talk to patients, that's how they feel. They feel like there is something wrong with their shoulder. It is dysfunctional. And over the last 10, 20 years, we have come away from suggesting surgery, but we still call it shoulder impingement. And this creates another problem with this type of injury, because what happens then is the patient is going to see typically a general practitioner doctor, a physiotherapist, or maybe a chiropractor or something like that, or an orthopedic specialist, but surgery is kind of taken off the table. But they're going in and they're being told that their shoulder is impinged. And when we ask patients, that's what they feel, that the only thing that can help is surgery because it's impinged, something is in the way, and they feel like something is wrong with their shoulder. So they do not think that any medication is going to help. They do not think that any stretches or exercises are going to help. They certainly don't think getting stronger is going to help. And they do not think that massage or any pulls and pulls are going to help either, because there's just something blocking it. So imagine if you are the therapist or the doctor and you're trying to treat someone who is already thinking in their head, your treatment's not going to work. Exactly. So this is the complication with this type of injury and why we have to just throw that terminology away. So anyone who's ever used it, forget about it. And this goes to you as well. If you're watching this, if you're a doctor or you're a therapist or however, stop using that terminology and tell patients, update them, tell them what's happened, because this is normal. This is science. This is what happens. Everything is true until a certain point, and then we get new evidence. And then we go, it was a hypothesis and it was incorrect in the end. So now we do things slightly differently. So that's a bit of the history of the injury, but do we know really what causes it then? And the honest answer is no, we're still kind of unsure. There's no common pattern. What we do see is that it gradually gets worse and worse over time. And we see that it is common in people who maybe do a lot of shoulder movements. So that could be anyone who is working a lot in the gym and they do a sudden increase in the amount of exercise that they're going to do, i.e. they maybe increase the weight a lot, or they do some throwing sports, maybe they play baseball, and it's just an overwhelming issue. So the capacity that the shoulder can handle all those muscles and joints and tendons I was talking about are here, and they physically exert themselves, and it's too much for the body. It's actually more than it can handle. And then if they do that repeatedly, it can cause the type of pain, and it can build and build and build. Think of it like when you're boiling some water, or you're making a soup, or you're making pasta or whatever, and you put too much water in and it starts jumping out all over the place. You think it's going to overflow. It's exceeding the capacity. You've just put too much in. Just something simple like that. So typically there is no accident or injury or trauma that anyone reports. And that is why we call it non-specific. But typically the pain is sourced in your rotator cuff region, which is why rotator cuff related pain is appropriate. The interesting thing is that it's always difficult to pinpoint exactly where that pain is coming from. So if we do any imaging of your tendons, we do some CT scans for instance, we will probably find that the tendons are thickened, but we know that that might not be causing any pain. We can find that there are muscle tears, but you can have a muscle tear in any of those muscles at any point and not feel any pain. We also know that from the research. And plus, on top of that, we also know that the space between the bones, the subacromial space, is not an indicative of pain as well. So it really is a confusing one for the practitioners, for the therapists, for the doctors, as it is for the patient. Basically, your shoulder is just getting unexpectedly sore, and its triggers are usually more psychosocial in the sense that it's more about your life as a whole rather than any individual actions or activities that you've done. You'll typically find that it's people who work more than 40 hours in manual labor type jobs. You'll typically find that it's people who are, for one reason or another, going through difficult times, feeling a lot of pressure, there's probably a lot of stress, and there's not a lot of rest and recovery in general. So nothing to do with the shoulder pain itself. They just don't have a lot of rest and recovery time. They feel a lot of pressure and they feel like life is already tough, and then the shoulder pain comes along and it gets even tougher. Those are the common things that we see when it comes to this injury, but we're still learning a lot about it. So that is a brief overview of non-specific shoulder-related pain. And if you listen to any of that and that felt like that sounded like your injury and your pain, then join me in the next video. We're going to go through some of the literature and we're going to see some of those treatment recommendations, which can hopefully help you see how you can make this pain better. Whether it's you bring this up with your therapist yourself or you follow on and do any of these exercises yourself. Or in the third video, I'm going to share with you my own program for helping you recover from this type of thing.